What is rotavirus? This might not be a question that pops up in your everyday conversation, but it's an important one. Rotavirus is a type of virus that causes acute diarrhea in children. It's the most common cause of viral diarrhea in children under 5 years old. Rotavirus is transmitted through the digestive tract, usually by consuming food or drink contaminated with the virus. Now, what are the signs and symptoms of a rotavirus infection? Diarrhea is usually the first symptom of a rotavirus infection. This can be severe, with frequent loose or watery stools that can be green or yellow in color. Vomiting often accompanies diarrhea. Fever is usually high, above 100 degrees Fahrenheit. Fatigue can make the child feel lethargic and listless. Loss of appetite can result in the child not wanting to eat or drink. Dehydration is the most dangerous complication of a rotavirus infection. It can lead to fatigue, dizziness, headaches, muscle cramps, dry skin, sunken eyes, decreased urine output, and even death. But how is a rotavirus infection diagnosed? A clinical examination is the first step. The doctor will ask about the child's medical history, symptoms, and conduct a general examination. A stool test can help determine whether the child is infected with rotavirus. A blood test can help determine whether the child is dehydrated due to diarrhea. And how is a rotavirus infection treated? Supportive treatment is crucial. Drinking plenty of fluids such as water, fruit juice, or soup can replenish the body's water and electrolytes. If the child has a high fever, fever-reducing medications like paracetamol or ibuprofen can be used. To reduce itching, apply cool compresses to the skin with a damp cloth or cool water. Wear loose, breathable clothing and avoid scratching the blisters, as this can lead to infection. Preventing complications is also key. In some cases, a rotavirus infection can lead to dangerous complications like pneumonia, liver inflammation, and gastrointestinal bleeding. Therefore, the child needs to be closely monitored to detect and treat these complications early. Currently, there are no specific antiviral drugs for rotavirus. However, some medications can help reduce the duration of the illness and the severity of the symptoms. So how can a rotavirus infection be prevented? Vaccination is the most effective preventive measure. The rotavirus vaccine can protect children from rotavirus infections by up to 65%. The rotavirus vaccine is recommended for all children from 2 months old. Personal hygiene, such as frequent hand washing with soap and water, especially after using the toilet and before eating, is essential. Consuming properly cooked and correctly stored food and avoiding raw or undercooked food is recommended. Only safe water that has been boiled or filtered should be consumed. Avoid drinking water from unknown sources. Remember, a rotavirus infection is a dangerous infectious disease that can lead to dangerous complications like dehydration. If a child has any symptoms of a rotavirus infection, see a doctor immediately. Adhere to preventive measures to avoid a rotavirus infection.